It's 94.7 FM Blair Radio, our nonprofit news brought to us by RVR Bank. Thank you to RVR Bank for being great sponsors and partners with us and bringing information about what's happening in our area. Today we are talking about Three Rivers Public Health and all what they do, partnering us. And the director, right? Terry Hewling is coming in.
Yes.
Thank you for coming and joining us today.
Well, thank you. Thank you for having us and letting us come every other week. We really appreciate that.
Well, we enjoy being able to let that information go because it really is about serving the community, about the needs, finding out what is most important for the community in the surrounding area.
Yeah, and you know, right now with just where we are getting ready to go into kind of the warmer months in summer, you know, there's a lot of different things happening, lots of different, you know, concerns. As you probably have heard, there was the first measles case in Nebraska.
Right.
And, you know, it's a matter of not if, but strictly a matter of when, you know, it will be in our jurisdiction. You know, we've been testing with clinics and hospitals, you know, for quite a while. And so, you know, there's that going on. We also are just getting into West Nile virus season. So we're doing some mosquito trapping and just trying to remind folks too, you know, about mosquito bites and making sure you're covered, not having standing water. And then speaking of water, you couple that with now swimming pools are open.
Yes.
You know, and people are at lakes on the weekends and, you know, the back swimming pools and their yards are open and just water safety and all of the things that go along with that. So there are so many things happening. You know, thankful that we've had a little bit warmer weather, but not thankful when, you know, it sounds like maybe later today and tomorrow there might be some severe weather.
Right.
So then that brings me up to being weather ready and knowing, having a plan, you know, no matter where you are, but keeping track of the weather, what might be happening in your area, and just if you need to seek shelter, where can you go to keep, you know, your family or the kids or, you know, your loved ones safe and what that might look like.
And you guys also have a program that assists first responders in that particular situation.
Well, so what we do is, so we have emergency preparedness. So we do a lot of emergency preparedness type activities. So, you know, we actually just hosted our first ever Stop the Bleed training. We actually have a individual now who is an instructor.
Okay.
You know, we also do CPR, those types of things, but we work very, very closely with the emergency managers in each of the 3 counties that we serve. So we work here, Washington County Sheriff Robinson. He's the emergency manager. Obviously, we have one in Dodge County. And then we also have Terry Miller in Saunders County, which you know him. And then Tom Smith, you know, in Dodge County. So working very, very closely. Actually, one of the things we just got done doing here in Washington County is last year after the Arbor Day tornado, we did some tornado response surveys. Went out, boots on the ground the middle of May, actually did those. So this year we just did a follow-up to that because really, how do we know if there had been differences made, if there was still needs in the community? You don't know unless you go and you actually ask and talk to the people that were impacted. So anyway, long story short, we did that. The Monday and Tuesday, we partnered with Douglas County. So it was a partnership with Douglas County Health Department, the University of Nebraska Medical Center, and then the Department of Health and Human Services out of Lincoln, and then Three Rivers. So Monday and Tuesday, we went and we worked together and did Elkhorn and Douglas County. Then Wednesday and Thursday, we came to rural Washington County, and then Friday used that. But again, boots on the ground, you know, trying to reach people. And I have to tell you, you know, as the health department, we can say, this is what your needs are, this is what we need to focus on. But with all honesty, how do we know that that's truly the case?
Right. It's one of those, it's a case by case or area by area. It's, you know, there's, you can't just blanket statement everything.
No. And so that's where this survey was so impactful because you are hearing from those that are living it, that are impacted.
Right.
And so you take all their data, right? You combine that, and then that's how you can formulate your findings and go from there. So that was eye-opening. I still could not believe some of the level of devastation I saw in rural Washington County and some of the people that are still living with this every single day.
Yeah.
So that was huge. The other thing, you know, that we've been trying really hard to do too is we now have our Washington County office.
Yes.
And so they are open. We actually have 2 suites. So we are open Monday through Thursday from 8:30 to 4. We have a nurse here 4 days a week. So in our public health suite, you can come in, you can get a water testing kit if you live in one of our 3 counties. So Dodge, Washington, Saunders County. You can get a colon cancer screening kit. We also have Narcan.
Yeah.
You don't realize until, again, you're talking to people, there's a significant need for that because there's not a lot of places people can go to get that.
Right.
And so, those are some of the things that we're doing on the health department side. We also have a car seat program. So if there's a kiddo that has Medicaid or WIC, they can, and there's a couple of other, parameters, like they can't have had a free car seat in the last year, those types of things. But we have certified car seat technicians that will actually install and show mom and dad or grandma and grandpa or, the caregiver how to do that. So that's one more thing, that we've been able to bring to Blair. And then we're doing immunizations.
Right.
And also some STI testing. Again, what can we do to meet people where they are and give access to services that they likewise might not be able to have? So we're doing well, trying to get the word out, telling people to come in and see us. But the one thing that I want to make sure is, so we're in the Vinton Corner building,
yes,
right at 1762 Washington Street. I tell people to go in the west entrance, which
the lower level.
Well, I like to call it the garden level.
Yes.
Because it is so pretty. There's like a garden out there, but you come right in there. You walk. Our office is right there. But it just keeps you off the main, the main
right.
drag. Parking isn't an issue right there, and you're just coming in, where it's a little bit more secure. So if people need blood pressure checks, they want to come in and they want to talk to a nurse. We want to do some of those things. There's an opportunity, to be able to do that. And this is the first time we have ever had an office in Washington County since the inception of the health department.
Right. And it has expanded it to a point where it can be staffed 4 days a week.
Yes.
So it's not like some places that, like Saunders County has a 1 day a week, which, it's you want to grow those things, but it takes cooperation with the community and funding.
Well, and so you bring that up. That's a good point. Yes, right now we're staffing it 4 days a week. If we would get busier, we would hopefully be able to expand those hours. But if funding continues to decrease, that 4 days a week is likely going to be changing too. We need to have a demand, right? We need people to be coming in to utilize those services. And then we're happy to do it as long as there's a funding source. But if that funding source goes away, we're not going to be able to be out in the community as much as we have been. We're not going to be able to staff all these locations because it takes people and it takes resources to be able to do that.
Right. And part of the funding source is also reliant on how busy are you? What's your impact into that area?
Yep. And I'll tell you, I had a meeting last week on some of our clinic services, with a funder. And we've grown, you take in there with COVID, obviously a lot of people had some drastic decreases, but then, you start to rebound. But the thing is, especially with clinical care and, some of the individuals that we're serving, it takes an amount of time to build trust and rapport.
It does.
And they have to feel safe. And not being out there, not being able to do some of these satellite things, if you're not out there, they're not going to know that we're there, and they're not going to feel as comfortable coming into some of our locations. So, I have a fantastic team. The health department is better than it's ever been. Rapport and people that are there because they love the work that they do, and they're public health minded. I could not ask for a better team.
Well, and that's part of that as well, because you get out there, like you're talking about the surveys, and actually following up. That is a huge thing. It's not just, we want to take your information, never hear about it ever again.
Exactly.
It's being able to follow up with that, but it's also letting people know that you're not just puppeting what you're being told from somewhere else. You are actually looking to be able to, this is what benefits here.
Well, and these are what the needs are here, because, and a prime example is, doing these surveys in Elkhorn versus rural Washington County, two completely different places with two completely different needs. And I, as the health department, can't come in and say, rural Washington County, this is what your need is, because honestly, I have no idea, what their needs are. So I had the opportunity to go out, boots on the ground, one of the days. I did it last year too. It was probably one of the best experiences I've ever got to participate in, because again, that grounds you into why we're doing this work that we're doing. We even went a step further on that Wednesday. I closed both of my locations, and I said whoever would like to go out, because I want people to be able to be involved in this public health work, right? So yes, my nurses are nurses, but more importantly, they chose public health for a reason. So I gave everybody the opportunity that wasn't on vacation, didn't have something else that was scheduled. And I tell you, some of the feedback and just words and just kind thoughts that I got from that, the impact that they felt they were able to meet, that's why we do the work that we do.
Right.
So it was just very impactful.
Yeah. So aside from the federal funding and things like that, is there other ways you can receive funding to be able to pick up slack here or there? If somebody's like, you know what, we need to be able to keep this growing. We don't want to rely on these funds.
Yep, we're working on that. Actually, I just got $4 million of federal HUD grants coming into the state over the next 3 years. So we're doing a lot of different things, but again, it comes with time and capacity.
Right.
And you can't, I mean, at any given time, it is not unusual for us to manage anywhere from 20 to 50 different grants, right? But with that comes a whole bunch of work, capacity, and when they're cutting things and we're having to jump through all these other loopholes, it makes it really, really difficult to do this job. I have been with the health department since 2011, and I have gotten to do, in my time here with the health department, what it would probably take somebody 4 or 5 careers to do. Now, I say that because that's awesome. You have to like changes. You have to be adaptable. You have to be able to hop around, do what you need to do. But that also causes burnout.
It does.
And not a lot of people, that's not how they like to work, nor is that their ideal environment. So as a smaller local public health department, you have to keep that in mind. So trying to have a little bit of something to do here and there, that's why we've also always had a lot of these smaller grants, because you can kind of, merge them together with different funding sources to use that to go ahead and fund a position. Some people do really, really well in that, and some people, not their cup of tea.
Right.
So being able to manage that too. But yes, we have a couple of different things that we're working on, getting stuff done, and just trying to continue to make decisions and be as fiscally responsible as we can. And
with that, obviously, a lot more hoops to jump through, but that also makes you have to really think about what is it that we're doing with these things.
Yep. And going back and really thinking about, is our house in order, and is there programs that we need to cut within our house? And a lot of the other households, and people in general, they're all doing that too, with their budgets, just with all, spending and that type of thing. I actually, was at a training here at the end of April, and one of the things, or the key takeaways, is the federal spigot is turned off.
Right.
You have funding spigot. And, that can be a good thing too.
Right.
Federal spending we have to get control of that, because we cannot keep on keeping on the path that we're on. Right. Yeah. Any kind of business owner, somebody who's managing things, knows that. However, there is a way to make some of those decisions, making sure it's fact filled and it makes sense. And so some of these, to allow some of us to go back into our organizations, okay, what is impactful? What do we need to have? And how do we streamline, where we are now? So those are some of the things that we're doing, at the health department. And, at the end of the day, I have a budget to balance.
Right.
And if I can't balance my budget, we're going to have to make changes.
You can't keep writing checks even though you're beyond your budget.
We need to be fiscally responsible and good stewards.
Yeah. And so, again, that's great insight that people have to realize that you have to do what you have to do. But like you said, it's a time at this point in time to take a look at those. We thought this was a good idea, situations that didn't quite pan out. Do we want to try to keep making them, force them in, or where is the impact that actually has to happen?
So we're in the process of that as we speak. We've had lots of conversation. I've been very, very transparent with all of my staff, and just wanting people too in the community to understand that, it comes at a cost.
Mm-hmm.
There's some things that we have to do no matter what. Right
Right.
now, that's emergency preparedness. If something were to happen, we have to be able to respond. The next thing is disease surveillance. We have to be able to do case investigations as outlined by state statute. It's just critical. And then the other thing is we have to be able to respond to disease outbreaks.
Yes.
So, when measles gets here, if we have to be able to set up clinics and we saw some of this during COVID too, when we had to do testing and we had to offer various, you have to be able to do that. And if you don't, that's going to have to fall back on somebody else.
Right. And
and just for people to understand that.
Yeah. So it's stepping up. For example, if there are some things that you have to put to the wayside, but there are a few people out there that like that. Just people have to kind of step together and see if there's another way to do that.
Yep.
So.
And the last thing that I think I would say is we work with people from all walks of life.
Mm-hmm.
And people don't understand what need is and poverty unless you've lived that, right? Or
Right.
you've seen people that have lived that.
Yeah.
A lot of people think, go get a job. And don't get me wrong, I am all for, supporting families and doing what we can there. But there are so many horrific things that we see, in clients and patients that truly need help. And access, is an issue for many of those folks.
Yeah.
So that's the only thing, I love helping others. I love trying to make a difference, having our communities be as healthy and safe as they can be. And I know with some of these changes, that are likely going to be happening, that's going to be impacted.
Yeah.
And,
And we already have a society or the culture around us is we can do it ourselves. We don't need the help already. So it's already creating a challenge in the first place.
Yeah. So. Until you see that and you see firsthand people that are impacted, it changes your vision a little bit, or maybe the lens that you're looking through, a little bit. So, but my key takeaway, though, why I'm here with you guys today is, as a health department, Three Rivers Public Health Department, we serve Dodge, Washington, and Saunders County. Mm-hmm. We are located now here in Blair, 1762 Washington Street, Suite 204 and 205. So, garden level, lower level, use the west doors. And we still have our same phone number that we have in Fremont. The great thing is you call that number, it's 402-727-5396, and you can hit the prompt for Blair, and it rings right to the Blair office. Yeah. So, and we are only there Monday through Thursdays. So please come in if you have questions, you want to see our space. We're trying to get a ribbon cutting, set up. I'm trying to do some of those types of things too, so be watching for that.
And then again, with if you're in those three counties, don't forget, all of the kits you can get that are part of the program, the colonoscopy kits, the radon kits.
Yep, water testing kits. We also dispense Narcan. We also do immunizations, and you don't have to live in our three counties for immunizations. Mm-hmm. We also do STI testing.
Yeah.
So, a lot of folks don't know where to go, and now we're right here, for people that want to utilize us.
And then it's summertime, so that means new safety things going on. Kids are out and about and all that stuff.
Yep. So if they're riding bikes, please make sure they're wearing a helmet.
Mm-hmm.
If you don't have a helmet, come to one of our bike rodeos. Swimming, water safety, watching the little ones, around the water. And also follow our social media. We put some really cool stuff out there. We actually posted last week about the Nebraska Lake Alert or Beach Alert. So it'll actually tell you anywhere in Nebraska that has high levels and if you should be swimming in them. So that's pretty cool. And there's 2 lakes in Nebraska that they're not recommending swimming, and one does happen to be in our jurisdiction.
Okay.
Which I don't think people swim a lot there anyway. But just good information. Follow us, and just for more information that I think is good quality information that is science-based and it's fact-filled.
And it's there for the community to be able to
make their decisions. Yep, based on what. Yep. And here's, I have these conversations a lot. People that believe different than me, that's not a problem at all. Right. Sometimes I think we can learn from each other, but find information, right, that is actually fact-filled, and then make your decisions based based off of that. That's it.
That's it. Let's go back to the old school news. You get all the information and you're smart enough to be able to figure it out from there.
Yes,
So,
absolutely.
All right. Well, thank you, Tara, for coming in and everything that you guys do.
Well, thank you.
And we look forward to continuing our work together, be able to get your information out and be able to continue spreading that word. So,
Right. We appreciate you guys. Thank you very much.
thank you.
All right.